You just hit the start button and you didn't even tell me that you were starting.
Because I can't stop
The laugh
laughing
is done.
at your hair. And then I figured we need to just start.
Well, I'm in transition right now. I kind of want to see what my natural hair looks like, and this is the process. I kind of
That's
want
so
people to talk about it. I want people to give their opinion. Also, not to make it worse, I broke my glasses today, and so they're kind of they're falling apart right here. And put I was gonna put tape on them, but I didn't want you to get mad at me. So if they do fall
I
apart while
think
we're filming,
I think you look fabulous. You look
oh,
fabulous.
thank
We
you.
we have an important topic today to talk about.
Wait. Hold on. Put your topic on hold because honestly, I need to talk about something that I think is really important. I got a little freaked out.
Mm,
A couple people I know have known for a long time. I wasn't very close with them, but know them for a long time. In the last 4 days, died of heart attacks, and they're my age, and that really freaked me out. And I meant to call you today just because the second one I found out about today, and it freaked me out. But I just didn't have to. I knew I'd talk to you tonight, and I thought I'm gonna just whatever we're talking about tonight. I just was going to interrupt you and say, can we just start with the heart attack? Because I don't know anybody who isn't afraid of sudden death.
well, so I mean, there's a reason that it's the number one killer in men and women, right? It's
Yeah.
the number.
And
You
these
can
were these
add,
were 2 men.
right, but women are dying, right? Since
Absolutely.
1989, since 1989,
Absolutely.
more deaths in women than men. It may have evened out now,
Really?
but
Wait, say that
um,
again?
since 1989, more women have died of heart attack than men. More women have
Do
died of heart disease than men.
do they know why?
Well, yeah,
Do they know why the
people have.
number changed? Like,
Well, okay, I don't know why the number changed. I think we have always been told, right, that it's a man's disease. But
absolutely.
women, as we get older, as we're postmenopausal, that heart protection that we get from our natural hormones go away. And then now, so slowly, the number of women that started getting heart attacks, have surged. Could it be kind of modern life, stress, smoking, all that has come into play, right? And it's now manifesting as heart disease in women. So all the
Yeah.
risks that men that cause men to have heart disease, women have heart disease as well.
Well, and also, I mean, I think you brought up a lot of good points actually. If I can just I know that we don't want to go deep diving into these because we're talking about one thing right now, but you taught me so much almost 3 years ago when I was having issues. I remember calling you a few times in the middle of the night because I was having repetitive heart palpitations, and it was very difficult for you to convince me that it was not a heart issue, that it was a hormone issue.
Mhm.
And we're going to talk about this at another time, but I just want to quickly, because there is a lot of myths out there about hormone replacement therapy women, and you really, really helped me with that. And I will tell you, it completely took out any issues that I was having with my heart. And the other thing that you made me think about when you were just saying that was, women fighting for equal opportunity in the workplace and in the home and things like that, which, bring that same level of stress into their life that used to only
Mhm.
be held on the man's life, right? Like he
Mhm.
was the one that went to work. He was dependent on being the breadwinner. And so now women and also single moms, it's
Well,
that number
now
has
the
changed
stress level
drastically.
for an average woman
Right.
is through the roof, right? Because she's
Right.
expected to be successful out there in the workforce and she's expected to be successful at home and she carries both burdens. We're, okay, so to keep us on track, so are
Yeah.
you good if we talk about plaque, right? So why is heart
Yeah,
disease the number
absolutely.
one killer? And just so we're clear, when there's obviously a multitude of heart disease. But what we're going to talk about today is heart attacks and why is heart attacks happening? So you said these were kind of young people that died, right? I mean, we used to
Well, I
think
said they were
that
my
heart
age, and
disease,
I'd like to think I'm 53,
well,
so I think that
yeah,
that's pretty young
we
for a
consider that
massive heart attack,
young, right? Yeah, because
right?
we used to
Yeah.
think, oh, it's like 70s and 80s, okay, you get a heart attack, it's almost like natural. Okay, there's nothing natural about having a heart attack. But I have a question for you. When do you think plaque, so buildup of plaque in the blood vessels of the heart, what age do you think that can happen?
Well, I'm going to assume at any age, right? Because you and I recently had a conversation about the importance of movement and how just being idle and sitting all day starts to grow plaque. So I imagine that if you are inactive, even as a child, but I don't,
So,
I really don't know the age, but I imagine that there's no,
it actually like the onset of plaque is what we call a fatty streak that happens in childhood.
yeah,
And in fact, there is this one study from the University of Naples, Dr. Napoli. Napoli, how do you say it? Napoli. Napoli.
Napoli, Napoli,
Napoli. Napoli.
Napoli, like your favorite pizza place at home, Napoli,
Napoli. Okay,
Napoli.
so he demonstrated that anywhere from 5 to 6 months of gestation, that means you're still pregnant with the baby. If there was an abortion or like a spontaneous abortion or the baby died soon after, and you look at the big blood vessel, the aorta, they actually saw fatty streak, which is the onset of plaque at
In the
5 in the belly, in the mama's belly. Now, these women, so
Wow.
the babies that had the fatty streak in the aorta, these were in moms that had really high cholesterol levels. But you can start building plaque in utero. And so if you look at, there's the Bogalusa
And I had no
study.
idea.
Bogalusa study looked at kids as young as 3 and they had plaque. 15, like 15-year-olds had plaque, right? There was a study that looked at these young veterans that died during the Korean War. Some of these 20-year-olds that had plaque that was well beyond 50%. So
So
I
can
have
I
a
ask you a question?
mhm.
Can I ask you a question? So, and maybe you want to finish your thought and then answer it, but I want to talk about generational diseases because when you're 3 years old, is that genetics or is that still lifestyle? Which could
Well,
become both, right?
it's a lifestyle of the mother, right? So the
Of the
mom had
right,
so in the baby, so the baby, you're still, there was a spontaneous abortion and they looked at the baby, right? There was an autopsy study. And what they found was like the beginning of plaque buildup. It was really found in the mothers with really high cholesterol levels. So, but in kids, but then you could say, well, what about a 3-year-old, right? What about a 2, 3, 10-year-old? So generally look at what's happening to our pediatric population. They are
yeah,
sedentary because they've got
yes,
their
video
phones.
games. Yeah.
They're eating ultra, so not just processed foods, ultra processed foods.
Oh,
So
it's
there's
terrible.
childhood obesity. So childhood obesity, inactivity, tobacco exposure, pollution, obviously
Pollution.
genetics, but I really don't want to focus on genetics because genetics is a tiny portion of you know the majority of heart disease is preventable. So then, how do you so okay, so what I was saying is I have a patient that's going to see me next week and he called me saying, I'm 71 and I just had a heart attack. And he's like, I don't understand. I have been healthy my whole life. And
Mm,
I'm thinking, man, your plaque started 40 years ago,
yeah, right.
at least 40 years ago.
Well, and for
So
anybody who's listening to this for the first time, you say this a lot, like, your fees are pivotal forks in the road, right? Because, like, you can either deposit to your bank or you can withdraw from it with every decade. You say that a lot. And anybody who's new to this, they don't quite, we haven't said that, but
yeah,
it's
because I mean, in a
important.
way, yeah, because we were spending, spending, spending. You get to 50s
That's
and
right.
you can, like, you can draw from the bank dry, or you can, and, look, at any age you can change. Obviously, we want to change kids, but, realistically in current society, that's unfortunately a big issue. But you get
It's
to your
so hard.
50s,
Yeah.
now it's like it's pivotal, right? It's so important that you change your lifestyle.
Sorry, I'm
So,
trying to get comfortable in this chair. Sorry.
with plaque, right? So if it's starting in childhood, then what do we do, right? What can you do? And why am I saying that heart disease is so preventable? So, it's such a complex biology But I want you to think of this LDL particle, but not just LDL particle. There are particles in your blood that tend to go and dig under the lining of your blood vessel, and it sticks there and it becomes oxidized, which then draws like this inflammation into the lining of the blood vessel. Yes. Question. Oh, what happened? We lost you there.
I
Okay,
don't know.
back. You're back.
But wait, am I back? My
You're back.
timer. Look at the okay. But are we okay? Did it cut it off?
I think we're
Look at the
good. It's
timer.
still recording.
What's their timer say though? Mine says 21.
Mine says 12 minutes.
Okay.
It's recording. Yeah. What was your question?
My question was, what's an LDL? I mean, some people don't know. And I think it's important to just kind of just because you're going to get into that. And I think just kind of real quickly, there's a good and a bad, right? And which one is that?
Well, it's a little bit, I mean, it's kind of simplistic to say good and bad. So there's your total cholesterol. And then we look at these components, the low density lipoprotein cholesterol, that's your LDL cholesterol. There's HDL cholesterol, there's triglyceride. So those three tend to be like the main players. But it's a lot more complicated than that. There are other cholesterol particles. They have something called ApoB. So this whole controversy about why do people with normal LDL cholesterol have heart attacks? It's because we're only measuring part of the cholesterol particles that cause plaque. If you want to look at all the particles in your blood that cause this plaque, and the plaque initiation and progression is complicated. We don't have to get into subendothelial deposition of the LDL, oxidized LDL, binding of glycoproteins, matrix metalloproteinases and fibrous cap. We don't need to talk about any of that, right? But there are
Breathe.
these particles. And so
Breathe
there
before you
are
have a heart attack.
particles in your blood that tend to create this disease, and that's all the particles containing ApoB. So for any of you listening, if your doctor is
Oh,
just giving you an LDL cholesterol, that's only part of the story. You need to ask them, give me a fractionated cholesterol panel. I want to know the particles because it's all the particles that have ApoB that determine your risk of having plaque and plaque
now hold
progression
on a minute.
and rupture and
Now,
whatnot.
I want to challenge what you just said because as a patient, sometimes we ask our doctors for things and there's a lot of resistance there, or it has to be coded a certain way in order for their insurance to cover it. Outside of a standard lab order, it is difficult for the average patient to get some of the things that they need. And in addition to that, it's difficult to know what it is that they actually need, right? So, how would one even know this? And what do they do if their doctor says, you don't need that? Because I've been in that situation before many
Yeah.
times. You don't need that. So, how does someone even get to that part? Well, I guess
Well,
we can actually put in this video because we've started, I know with there are ways now with these functional labs and things like that that are
yeah, I
offering
mean, now better than ever before, right? You can order your
ever.
own
That's
lab,
right.
right?
It's true.
So,
Any lab
and look,
test now is great.
yeah, but for individuals that are like, oh, that's nice. I'm glad you guys have the money to go order your own labs. I wanted to go through insurance. I think, look, the bottom line is that you have to have a physician that advocates for you. And if you don't, then
That's
you have
right.
to advocate for yourself. And frankly, if they're resistant, you need to find another doctor because
That's
this
right.
should be standard care. In fact, the other important thing is that you need to look at your ApoB levels, but you also need to look at something called LP little a. And if every single
Sometimes I
human
feel like you're
being
making this stuff up.
every single human being on the face of this planet needs to know their LP little a levels because
LP
that
little a.
LP, so L, big L, small p,
I'm
and
trying to
then
find a pen.
the A,
I can't
A
write it down. There's no
the
pen.
A in parentheses. You know what? We'll put it on our show
Thank
notes here.
you.
Okay. So
Thank you.
because of that, you need to ask for this. This is like this is like standard cardiac assessment. So
It's not because as a cardiologist, were you running these for every patient?
wait, ask me that question again.
As a cardiologist for 24 years, were you running these labs for every patient?
Well, okay, in full honesty, not initially, but then the more, and now with LP little a, we actually have emerging treatment for LP little a, so I've been telling everybody to check it. I tell
Good,
everybody,
good. Thank you.
please just get a fractionated cholesterol. Yeah. Part of it too, though, is that we have 6 to 10 minutes per patient. So,
I know. I know.
most of the time you're
You're
just
doing the best you
putting out
can.
you're doing the best you can. And so
Right, because 'cause they're
that's true
coming
for
in for
me.
something totally different, they're coming in for something else, and it's like you don't have
Right.
the time, and this is why holistic care is so important. It matters, when people think of holistic care, they think of, quack jobs. It's like holistic care means that we are treating the body as a whole, and you have to start somewhere, and yeah,
Systems.
like you
Yeah.
said,
We're
this should
treating
be
all systems.
standardized healthcare.
Yeah. So, okay. So there are these particles in your blood that your doctor needs to know to test for, that you need to advocate for. So 2 words, ApoB, LP little a. That's it. At least as far as the cholesterol picture is concerned. We have other labs we can talk about on a different topic. But okay, so here's my
But
next question to you.
this will give you this gives you a great head start as to where we need to
Oh,
go
yeah.
in regards to your heart health.
To understanding your risk. Now, if you have high risk, meaning you're diabetic, you have high blood pressure, you have high cholesterol, you have a bad family history, you are a smoker, or you were a smoker. If you are a smoker, just quit. It's quit. There's nothing I can say. Quit smoking.
I am shocked when I see people smoking. I'm
Well,
shocked.
it's an addiction. It's an addiction.
Of course.
It's
No,
easy
no, no,
for us
no.
to say quit,
No, no,
but
I
yeah.
just with the young people especially.
Yeah, I mean, there's no reason in modern day anyone should pick up a cigarette for the first time. Okay,
Yeah.
so that aside, if you have really high risk factors, I would even advocate getting a CT calcium score, because what
Okay.
that
You
does
did that to
is that
me. Yep, you did that to me.
what that does is you look for any plaque that has calcium deposits. If you have calcium deposits within the walls of the blood vessels of your heart, you have plaque, period, end of discussion. Now, it doesn't say you have a 10% plaque or a 50% blockage. It doesn't tell you that. It just tells you that
Okay.
you have plaque. Okay, so now here's my next
It
question.
means that you are early stages or in at some stage of an event.
Okay, so that dovetails into the next question. Can a person with a 30% blockage have a sudden heart attack? Or is it a person with a 90% blockage that has a sudden heart attack?
Well, I'm not a doctor, but I'm going to have to guess that both are at risk depending on their lifestyles.
So both are at risk. Obviously, the 90% person is kind of like knocking on our door saying, hey, something's wrong. I get this like
Yeah.
heartburn, you get pain, it goes to my back, I don't feel right in my jaw, I break out into a sweat, I'm tired all the time, something is wrong. The 30% could be running a marathon, right? Because at
Mm.
30% blockage, there's no restriction to flow. But how does a person with a 30% blockage suddenly, have a heart attack?
Yeah, it's so
It
scary.
So the plaque ruptures because the
Oh,
fibrous cap that's holding this like nasty plaque, right? The body's amazing. You have like this nasty, nasty plaque. The body actually forms a fibrous cap on top of it, but the cap can get eroded. And then you get exposed to that nasty, gunky plaque. And then instantaneously, you have a blood clot, you have a heart attack. About
that's what I was going
one
to
in
say. So is that
five
like an aneurysm, right?
no, no, no.
Similar?
An aneurysm is a dilation of the blood vessel. Different. Similar. The
Okay.
the beginnings of it is plaque related, but this is like you have a hose and you have a blockage. You've got a little bit of plaque. It ruptures and now the blood clots and now you have 100% blockage. It's 100%. It's blocked. You have a little plaque,
Scary, isn't it?
ruptures, got a blood clot, blocked, no blood flow, heart attack. About 20% don't even make it into the hospital. You die instantaneously. Right. So, and
And
and remember what we said. This starts at
what?
age 2,
Well, or in
right?
neuro, in
Yeah, I mean, in utero,
Euro.
it's in, yeah,
I mean,
it's been demonstrated in the aorta, but, you know,
in Europe, it's in euros.
in utero,
It starts
in
in
utero.
when in
So,
euros.
so,
We're on a
so,
different time zone.
yeah, what time is it for you? You're in
11.
Sicily still?
But
It's
what's been happening, I'm in still in Sicily. Still in Sicily, an amazing, amazing agricultural area, but where they grow and produce, and there's so much to talk about on another topic, but it is impressive. But I think over the last 4 days, I have been up, like, for 4 days.
Okay, so by the way, okay, so that brings me to the next point. You said you haven't been sleeping.
Well, I
Sleep,
normally sleep wonderful, but
yes,
just these last
yes.
couple days, I've just been going to bed late, and but I like, today, I today actually took a little nap by the
Nap,
pool,
yeah,
which was
just like the
so
Italians,
nice.
the Sicilians. Okay, so poor sleep leads to inflammation. Okay, I'll ask
Yeah.
you, what are the things that lead to inflammation that causes erosion of this fibrous cap that keeps this plaque from being exposed to the blood? What are the things that cause inflammation? So
Well,
poor
like,
diet.
specific, or can I just say, I was gonna say, can I just say food and drink, right? Poor diet,
Yeah. So poor diet,
lack
lack
of
of
movement,
movement.
and lack of sleep, quality sleep.
Consistent, yeah, consistent poor quality, poor quantity sleep.
Period. I mean,
Stress,
I
right?
can stress, oh my gosh, stress, absolutely.
Right?
Depression,
So
stress,
then
trauma,
so then this
unresolved trauma.
so then this creates high blood pressure, high cholesterol. Obviously, there's a good percentage of high cholesterol that is genetically mediated, but there's so much that you can do, even with genetically high cholesterol, to help mitigate it. So this high cholesterol, high blood pressure, diabetes, insulin resistance, there's actually this like great biochemical mechanism as to how this happens, right? So when you have insulin resistance, when you have high levels of insulin, high levels of glucose, there's this reduction in nitric oxide that happens, which is very important in protecting the lining of the blood vessel. And then, so not having that puts the risk for injury to the lining of the blood vessel, which then is what that LDL, these plaque producing particles, can hit and bury under and create plaque. So there's like this really cool biochemical mechanism as to how this actually happens. But we know that LDL, these cholesterol particles, create the plaque, but inflammation starts the fire, inflammation continues the fire, right?
Yeah, it
Until
just
it
feeds it,
explodes.
right? Until it
Until it
explodes.
feeds. So
Yeah, it feeds it.
LDL
Yeah,
particles start the fire, inflammation continues the burn. And
yeah,
so, which is why so much of heart disease is preventable. So if
right.
you lower your
Well, so much
cholesterol,
of all disease is preventable.
well, of course,
If you
but
can minimize
this in particular, right? This in
inflammation.
particular. Yeah.
Yeah.
So
But
people
I
that
mean, that was pretty profound how you described it, right? It's like until it explodes. I mean, it's really what happens, and it's so, so frightening. I
and
mean, we
and
have a
people that say, "Oh, I
huge,
don't understand. I've been healthy. I go to the gym. I have
yeah.
no symptoms, and I just had a heart attack." They
Can I
look at us like we're the assholes that told them they had a heart attack, right?
can I
I can't tell you the countless number of times that people question the validity of our statement
I
because they're
can't
like, "What do you mean?"
tell you how many people I know that pride themselves on going to the gym and then go to happy hour and
Right.
eat wings and drink alcohol. And they genuinely will say, like, well, I earned that.
You
And
are
it's like, but
just creating inflammation. Remember,
it's terrible.
it's really pretty simple. You cause injury to the lining, the particles that create plaque get stuck, inflammation happens, and then your continued habits that cause inflammation continues to either make the plaque bigger or worse, explodes.
So, all right. So there's a few types of people, right? We have those that are born with it, may not ever know that they have it,
Wait, born
and
with
the fatty lining, right?
okay,
It's
but
it's happened before they're
yes.
even born.
Yes, but
And
at
so now,
fatty lining, you can reverse it. Even at
right, but
plaque, you can reverse it.
these are individuals that they don't even know they have it,
Right.
right? Because they haven't
Yeah.
had an event.
What 13-year-old is walking around thinking, oh my God, I have plaque. I have early stages of plaque and the blood vessels of my.
Exactly. Also, but hold on a second. But now more than ever, this is my opinion, but I think you would agree with me. There are overweight children.
Oh, absolutely.
It
It's
is
huge. Okay.
it's
I'll
so
tell you.
sad.
It's so sad. When I was in medical school now, That was many, many decades ago. When I was in medical school, there was a few kids that I saw that had type 2 diabetes. Now
Yeah.
it's ridiculous. The kids
So,
that have type 2
real quick,
diabetes.
because we're gonna go back to that topic, but tell just really quick, tell the difference between type 2 and type 1. And
Well,
now
so
they're coming up now they're starting to talk about a type 3 because everyone is so sick and so overweight.
type 3 because now like Alzheimer's dementia is like type 3 diabetes. So type 1 is that your pancreas is just doesn't work. It doesn't put out insulin. It happens to kids. But he
You're kinda born
so
with
you
it.
need to give kids insulin.
Insulin,
Um,
that's right.
right. So they need insulin. Their pancreas is done. It's a possibly an autoimmune situation. But there are many people now with type 1 diabetes that also have type 2 diabetes, meaning we're giving you insulin, but your body's not responding to the insulin that we're giving you. So now you have type 1 and type 2 diabetes. So type 2 diabetes is that your pancreas for now is putting out insulin, but none of your cells are listening. So you have to
But also it's an
crank
overdrive.
so now you have to crank the amount of insulin for the cells to respond to the insulin.
I didn't even know you could have type 1 and type 2 diabetes. I
Yeah,
just learned that in this
because
moment.
you can be overweight and have a poor exercise, poor dietary habits because they're like, "Oh, I could eat whatever I want. I take
I'm
insulin."
on insulin. Right,
No,
right,
doesn't work that
right,
way. Doesn't work
right.
that way. Yeah.
And so but then you said, well, type 3 diabetes is more about the brain, dementia, and all that, but hold on a minute. We are learning, some of us kinda knew this already, but they're now finding science-based evidence that it's coming from the sugar intake, right? Too much sugar on the brain causes the dementia and the Alzheimer's.
Well, it's a little bit more complicated. And yes, absolutely simple sugars are not ideal for anybody, well, unless of course, like for example, there's people that run marathons, right? And they're putting in like a ridiculous amount of sugar
Yeah,
per
they're burning
hour
it though.
as they're running the marathon,
Yeah.
right?
Well, it's fuel for them.
It's pure fuel for the muscle,
Yeah, yeah.
right? So
But if you're
it's
gonna go sit on the couch,
but there's many aspects to why there is oxidative stress, mitochondrial dysfunction, amyloid beta accumulation, tau protein, blah blah blah. There's lots of reasons. Yeah, sugar's one of them. Inactivity is another. Any processed food is a huge one
yeah,
because
we have to
frankly,
talk a lot about that another
right,
time.
because frankly, you can eat sugar, burn it, and nothing's going to happen to you. You eat sugar, you burn it, nothing's going to happen to you, right?
Yeah,
You eat processed food, that's a different situation altogether.
it
So
is, it is.
it's a
It's a
little bit
and we've
more
gotta do a
complicated.
whole we might have to do, like, a several part series on that one because there's just too much to say.
Okay, so just to sum it up, heart disease doesn't magically happen at 50, 60, 70, 40 people having heart attacks. It happens so ridiculously young. B, you need to be your own healthcare advocate. You need to ask for a complete particle by particle analysis of your cholesterol called lipid fractionation, cholesterol fractionation.
And
You need to ask
we'll put that all
you'll
up
put
there so that people can
Yep.
get the
You wanna
information,
you wanna
yeah.
know your ApoB levels. You wanna know your LP little a, which by the way just has to be checked once in your lifetime, LP little a, and
Really?
then understand that I personally think 95% of plaque buildup and heart attack is preventable. Even if you have plaque, you can do so much to stabilize the plaque, really build the fibrous cap so nothing erupts and explodes and causes a massive heart attack or stroke for that matter. Because what we talk about, the blood vessels of the heart, the same can happen to the
That's
blood
right.
vessels in the carotids and the blood vessels in the brain.
Oh, it scares me.
And if you can just focus on reducing inflammation and oxidative stress, you will make a massive difference to your risk of a heart attack. And I guess next podcast, we can talk about all the different ways to really think about reducing your risk.
Well, but before you leave them, I mean, just give them at least 3.
Well, okay, look, yeah,
Well, and
I'm
I
not
think
going
we
to
did.
advocate,
Minimize your sugar intake
well,
and processed foods.
minimize processed foods, right? Really
Processed
minimize
foods,
processed foods.
move
Um,
more,
Move more and stress less. and love more.
I
Love
love you
yourself.
more.
Love yourself first, and then it all comes out of you to love everybody else. I know.
Yeah, the world's it's yeah, we need a lot more love in it.
Yeah. Okay,
Wow.
so that's our story.
That's a
It's good to know. People need to know. And then
it's good to know.
we can break it down and people can let us know what they want to hear.
That was a big one. I'm still processing it all. Thank you. Thank you for sharing all that. I mean, I think for anyone out there who is, having issues or being diagnosed or questioning whether or not they have issues, I think that the what was it called? What was it called? The particle
Fractionating, just they tell them you want
fractionating.
the particles. You want to know how many of my cholesterol particles do I have that cause plaque?
Yeah. Yeah,
Because just getting
exactly.
LDL, it's only part of the answer.
Yeah, yeah. Wow. Good information. Thank you.
Okay.
Thank you so much. And we love you guys.